So, Angela, I'm so excited today because we've had a lot of great guests coming on and sharing their experiences with us. And so I'm going to let you introduce the next guest. Are you ready?
I am
All
ready.
right. So I'm really excited. So
I
go ahead.
have Dr. Ann Hester. She is an accomplished physician and an author. So we're going to let her go ahead and tell us what she has for us today.
Good morning, ladies. So happy to be here. How are you?
Thank
Good.
you so
How are
much.
you?
So essentially, I am an internal medicine physician by training, the author of Patient Empowerment 101, More Than a Book. It's an adventure. I'm a soon-to-be health coach in a few weeks. We'll be taking people through some things that will teach them how to prevent, treat, and reverse diseases. I created patientworld.net, which is an on-demand platform where people can go to sign up to take a variety of courses. There are other things, but that's enough for now.
So, Dr. Hester, can you just tell us a little bit? Because I keep getting this thing because people are like, "Hey, Dr. Taylor, you are saying you're a career coach," but people get, "I am a health educator." So it's great to utilize this platform that God has blessed us to be able to do things that are impactful for our community, right? And so this thing when we're highlighting Black excellence during Black History Month, this platform has been so important. You and I have had a lot of back and forth conversations,
Yes.
and I just want to really you to just make sure that you are sharing, what inspired and motivated you to go down the career path that you went. And I want to move. You heard an opportunity to hear all of the guests today, right? And you really are the culminating point of when we talk about hearing all of these needs and listening to what's happening in our community about self advocacy and learning to speak up. And Brittany said a few buzzwords that I need to make sure I explain to the audience when we get this discussion. You can explain the unconscious bias, those things that we may be dealing with that we may not even recognize. Because let me tell you, like the average everyday person, they're not going to know what unconscious bias is, right? Like as healthcare providers, we know, and I teach these courses on cultural competency. But I would love for you to just explain, what inspired you to get into your career and to go in this direction of self advocacy for patients, and patients speaking up for themselves.
Certainly. My father was the first African-American physician in Evansville, Indiana. And he did so much when they died. They renamed the Evansville Community Center, the C.K. Newsom Center. When I was growing up, people would always come up to me, "Hey, your daddy did this, your daddy did that." Because of Dad, the schools were integrated in Evansville. And so he was a real pioneer dealing with the Black community and healthcare. So that's how the ball started rolling. Now, as I went to medical school, I remember being a third-year medical student, seeing a lady with a mass about this big on the breast, the left breast, draining pus. I was a student. I'm thinking, you have breast cancer. It's too late to cure you. I didn't say that to her, but you just see things over and over and over. And when I was a third-year student, when we had time to relax, we weren't studying, my colleagues were out partying, doing other things. I was writing my first book, Bridging the Gap to an African American Guide to Health and Self-Empowerment, because I saw so much unnecessary suffering and death. It was horrific. And so my entire career, I have been about empowering people to take the next step. We don't have to suffer and die unnecessarily. 4 out of 5 visits to the doctor are due to conditions that are treatable, preventable, and reversible and related to lifestyle choices. And so we need to understand the role that we play. Certainly doing these things is not going to prevent everybody from becoming a diabetic. It's not going to prevent all heart attacks. But we know that millions of people die every year from something that is preventable, treatable, or reversible. And so we need to educate ourselves. We're looking at a shortage of 124,000 doctors in 10 years. If you add on the currently unmet needs in rural America and certain urban communities, then it's 180,400 doctors short in 10 years. How are you going to get in to see a doctor? How are you going to be able to take care of yourself and your family? So we need to be proactive and think now, do those things so we are healthier. So when this medical tsunami hits in full force, it's not going to mean quite as much that we may not be able to get in to see a doctor for 5, 6, 7, 8, 9, 10 months, and we may have 3 to 4 minutes face to face with the doctor.